Hi, in this video we will read about scurvy caused by the vitamin C deficiency, and the role of vitamin C is it helps in the maintenance of connective tissue, that is collagen. Collagen is formed by the hydroxylation of this amino acids, like that is proline and lysine, and vitamin C is needed for the process of hydroxylation. Wound healing is similar to zinc. Absorption of iron from the intestine. These are all the roles of vitamin C. And osteoid formation. Fine, so vitamin C is needed for the maintenance of the connective tissue, wound healing, absorption of the iron from intestine, and osteoid formation. Vitamin C rich foods are the citrus foods, orange and lemon, and green vegetables. Okay, so these are the vitamin C rich foods. Now, who are at risk groups? Children consuming only pasteurized cow milk. Breast milk has sufficient vitamin C, but not the cow milk. And children consuming diet lacking the vitamin C are at risk of developing its deficiency. And due to the deficiency of vitamin C, features of scurvy will occur. So, what will be the early features of scurvy? It is irritability, decreased appetite, anemia, petechiae, that is increased fragility of the capillaries, and bleeding manifestation. Bleeding manifestation will be seen in gums and perifollicular bleeds like corkscrew appearance of the hair and subperiosteal bleed, pseudoparalysis due to the painful movement. What is subperiosteal bleed? Periosteum is the covering of the bone, and if there is bleeding, that will lead to painful movement, due to which the child will not move its leg wherever the bleeding has occurred, and this will lead to a condition that is pseudoparalysis, that is there is false paralysis. Why is paralysis happening? That is, the child is not moving his or her leg because of the painful movement, and there will be a frog leg posture, that is flexion at the hip and the knee. This is the posture of the child suffering from scurvy. This is the image of bleeding gums. So these are the features that we saw, early features. What are they? Irritability, decreased appetite, anemia, petechiae, bleeding manifestation like the gums, perifollicular bleeds, subperiosteal bleeds. Also there is scorbutic rosary. This scorbutic rosary, this has tenderness, and there is angulated appearance of this scorbutic rosary. Okay. How is this? This has an angulated appearance, and there is also tenderness. In the rhachiatic rosary, which was occurring due to the vitamin D deficiency, there was no tenderness. So this is the difference between this scorbutic rosary due to vitamin C deficiency and rhachiatic rosary due to vitamin D deficiency. In scorbutic rosary, we read, right, there is tenderness is present and it is an angulated rosary. But in rhachiatic rosary, there is no pain and there is a rounded rosary as compared to the angulated one in vitamin C. Now, what will be the radiological findings in the scurvy? On X-ray, we will see a white line of Frankel. We will see images of this also. Okay, just wait. On X-ray, there will be a white line of Frankel. There will be a well calcified cartilage. There will be a scorbutic or the Trümmerfell zone, that is a central zone of rarefaction, represents poorly formed bony trabeculae. There will be a Pelkin spur, that is the lateral zone of rarefaction. There will be a ring epiphysis, that is also called as the Wimberger's ring. There will be ground glass appearance, and there will be pencil thin cortex. Let's revise these features seen on the X-ray. There will be white line of Frankel, there will be scorbutic and the Trümmerfell zone, which represents poorly formed bony trabeculae, Pelkin spur, that is the lateral zone of rarefaction, ring epiphysis or the Wimberger's ring, ground glass appearance, and pencil thin cortex. Diagnosis is made by the clinical appearance of the child. What will be investigations that could be done? It is the leukocyte vitamin C levels using the Buffy coat, serum vitamin C levels. This is the best investigation that could be done. For the treatment, we have to give 100 to 500 mg per day of vitamin C, equivalent to 100 ml of orange juice or tomato pulp. Fine. 100 to 200 mg per day. This was the image that we were talking about in the X-ray above. This is the subperiosteal hemorrhage. This is the scorbutic zone, that is the Trümmerfell zone. This is the dense zone of provisional calcification of the white line of Frankel. This here is the ring epiphysis, that is the Wimberger's ring, and this is the Pelkin spur. Fine. So this was all about scurvy. Thank you.